have a patient who is 32 years old and who is a primary school teacher who has asthma since adolescence and has seasonal allergic rhinitis, who is non-smoker. This is very important. Alright, so and in the area with moderate air pollution, which means that it triggers their asthma. They use salbutamol Ventolin as for relief for sudden attacks in emergency, and also they use Symbicort, which is daily, and cetirizine. Alright, and now sees increased shortness of breath, wheezing during the last 2 weeks, nighttime symptoms occurring 3-4 times per week. Okay, so these are asthma symptoms, and seeing asthma symptoms when you are using asthma drugs is not normal. So this means that either this person is taking the drug in a wrong way. For example, the technique is wrong. For example, they are doing the puffs whenever they want or whenever they feel bad. When they feel good, they don't do it or they forget it. And secondly, it could be something triggering it. It could be even like a pet, something triggering them. It could be like a beta-2 blocker drug. It could be dust, kind of these things. And if these are not working, I cannot find the solution, let's say, I would talk to the doctor and want to change the drug or change the dose. And now, or another case is this. We have a patient who is 45, who is a taxi driver in Athens and smokes 10 cigarettes a day. Why did I say Athens? There's the heavy traffic which is triggering his asthma. Alright, and he's smoking. So this is the worst thing that you can do in asthma. He's using salbutamol Ventolin for sudden attacks, alright, and fluticasone daily, and amlodipine because he has hypertension. This is calcium channel blocker. And now he sees shortness of breath for 3 days, wheezing, chest tightness, and dry cough. So these are, until the cough, these are classic symptoms of asthma. So this person is also using asthma drugs but has asthma symptoms, so this is not normal. Dry cough can be due to asthma itself or air pollution, or it could be even smoking or asthma worsening. When asthma is worsening, we call it exacerbation. I don't know the pronunciation, I'm just gonna write it exacerbation. What should we do? Again, we're gonna check the technique and then the triggers. Then we can talk with the doctor. We can talk with the doctor to add maybe something like, maybe doctor can add LABA too. Or we can do flu vaccine, we can do pneumococcal vaccination. This is pneumococcal. Or we can do rehabilitation. Okay, so here, this is the best one in my opinion. We have a patient which is 68 and which is a retired factory worker at gold stage, which means that they are at the moderate stage, and former smoker, which means that they stopped smoking. They stopped 2 years ago, it says, and uses tiotropium. This opens their airways all day. And also they have salbutamol Ventolin, which is subbronchodilator, and they have metformin and amlodipine. Metformin for their diabetes, amlodipine for their blood pressure. This salbutamol is for the sudden attacks as saver, but the problem is that he takes it 4-5 times per day. He takes it too much. Once you take it for too many times, it also causes problems. So he shouldn't be taking more than he needs. He have increased breathlessness. This means that his airways are still narrow in COPD. And there's a productive cough with white sputum and 2 mild exacerbations in the past 6 months. Okay, he should continue to his tiotropium, of course. And he should continue with the salbutamol, but salbutamol, reduce it, don't take it that much. This white mucus means that he has productive cough, And this exacerbation means that he had attacks. Never forget, Ventolin is for the emergency. Salbutamol, Ventolin is for the emergency. This is the first thing that they should do. They should reduce. They shouldn't take that much, that many times. And second thing is that their airways are still narrow. That's why they have breathlessness. We should do something for this. Maybe like a new treatment. And the third, this exacerbation is the problem here. Because having attacks more than one time in 6 months is meaning that we cannot manage this disease. We cannot manage the COPD with these drugs. There is a problem going on. So I think that another long-acting drug or long-acting plus, LABA and LAMA can be also given. LABA or LAMA plus LABA should be given. This will be better for the breathing, better for the exacerbations, reducing their symptoms and reducing their Ventolin salbutamol use. They could also do pulmonary rehabilitation. This is a breathing exercise and it's giving education, improving the daily activity, quality of the activity, and their inhaler technique is very important. Mesela mucus, I started to talk Turkish. Okay, so if the mucus is yellow or green, it means that that's bad actually. And to prevent the future attacks, we can just get flu vaccine, pneumonia vaccine, avoid the dust and air pollution triggers. Okay, so we have a patient who is 72 years old, very old, and at the gold stage 3, which means that we have severe COPD going on. They have hypertension, osteoporosis, depression, social history, former smoker, but 5 years ago, lives alone, limited mobility, so she cannot move, and alcohol use. Alright, so tiotropium, salbutamol, Ventolin, sertraline, amlodipine, alendronate, calcium, vitamin D, these are used. She has increased breathlessness and productive cough, yellow sputum. So yellow sputum here is showing us that there is infection, fever, infection. Oxygen saturation, she has low oxygen levels. Give her oxygen right now. Oxygen therapy is a must. She has infection, wheezing and crackles on oscillation. Okay, so firstly we're going to give her oxygen, the oxygen therapy, and then like I told you, with the fever, with the yellow sputum, and with the oxygen, it means that she has infection going on. So give her antibiotics. The doctor will give her antibiotics for her lung infection. She needs to drink enough fluids. She's not moving, so it's going to be worse. But why did this happen? Did she do a mistake with the technique? No, she's very old. She already has damaged lungs, by the way. She cannot move. She lives alone, and she's very old, like weak lungs, age, and less movement. That's why, it happened. So the only thing that can be happening here is giving antibiotic because she has infection going on. Antibiotic could be something like azithromycin, but of course we still can check the inhaler technique just to make sure that it's not gonna get worse and worse. But if they don't have a penicillin allergy, we can give amoxicillin. The doctor can give amoxicillin plus clavulanic acid for the respiratory infection. I'm so sorry, lung infection.